Some people may just be feeling a bit uneasy. That may just be it. And they can say it's malaria and take malaria drug and do all sorts of things. But eventually, when that BP keeps going up unchecked, you're not doing anything about it, you're not even checking it, and it starts damaging the heart, the cardiovascular system, other organs, kidney, brain, everything. When it does that to a large extent, and boom, one of the cardiovascular accidents happen, one of the sudden one happens, you see them bringing the person with a stroke, or they are losing vision, or they are now swollen all over. The urination, they can't urinate much, it has reduced, maybe the kidney is failing, or the heart is not able to pump, and they are so tired. When they lie down flat, they start breathing fast. So these are the things that can come from hypertension, and it's not something we like. It's something we want to try to stop amongst our people, something we want to prevent amongst our people. It's possible to know these things early. It's a good thing to check your blood pressure from time to time, especially if you have a family history that you are hypertensive. Your mother, your father may be hypertensive, or your uncles, your aunties. You may do well to check them. Some will check every month, some will check to 2 months. For me, it's not a big deal. It's something that you can afford to do. It's always good to find out this hypertension early, so that we prevent these cardiovascular diseases and complications from hypertension. They are very preventable, and good thing, their drugs are everywhere. So if you present yourself to the hospital and the doctor assesses you, he will put you on medication. And it's not everybody you give amlodipine, as people will just do. Everybody just give them drug. No. You need to be assessed well based on the risk factors you have, based on your current states, cardiovascular states. Drugs will be chosen and given to you. The best drugs that is best for you will be chosen. So, and it's important you adhere to these medications. It's important you take these medications regularly and check your BP regularly and come for your checkup regularly. They are all good. I have many patients who have that habit. If it's one month or 3 weeks that they come to the hospital, to the clinic to see regularly, any problem they have, it is tackled, and we don't have these complications coming. That's the target. If we have these complications minimized, people will have a better quality of life. You will prefer to live walking strong and doing all the things you are doing, but the only thing you are doing is you're popping in 2 tablets or 3. Then you are bed bound, you can't walk, they placed you on wheelchair or on the bed and you can't do anything. You will not like that state. So that's why we are preaching this message that you should take it serious. So once you see that you are hypertensive, whether you were told that during the time you were giving birth, that one is another one that happens. Some ladies during childbirth, they develop one of the hypertension problems, and after childbirth, some of them take time before they start going down. Others will not bother. They will see it has gone down small and stopped taking their medications. Others will follow it up and also stop. But the issue is that it's good you follow it up. That's a sign that you may eventually develop hypertension later in life. So you should watch it. If it's monthly, you want to do it, fine. 2 monthly, 3 monthly, fine. Checking the blood pressure is not something that is out of this world. It's something that you can do, you can monitor on your own. I always encourage patients to have their own book and chart where they measure these things and monitor, so that when you come to clinic and we discuss, you will also make inputs as to what happened. At this point, this thing happened to this BP. I took this, I didn't take this, I skipped this, so that we'll discuss it, and the best set of drugs and adjustments will be made for you. So it's very important that you recognize this blood pressure on time, and when you recognize it, you monitor and take your drugs diligently. If you have your problems with your drugs or a new issue, you speak with your doctor, you schedule for a clinic visit, and you speak and interact with your doctor. The aim is for us to be healthy and strong. Even in the presence of cardiovascular risk factor, we can be healthy and strong and do what we ought to do, and do them very well, and be alive to enjoy life, to enjoy the family you have, to enjoy the money you have acquired. That's the aim. That's where we want everybody to be. To be strong enough to enjoy them, and not being bed bound, not being wheelchair bound, not being confined to a bed or a chair. We want you to be strong, healthy, enjoy life, even in the presence of hypertension. Okay, I think we'll stop here for the moment. So I will also encourage you once again to click the like button, subscribe to this channel, and send this particular discussion or talk or message, or send this channel, share it to your family, your friends, your loved ones, especially those that are adults and elderly people. They're the ones that are really affected with this hypertension. So it's important that you share this, because this is something we take time to talk to people about in the clinic, but of course we don't have all that time to talk to everybody in the whole country or the whole state. So this is an avenue. If you can send them this link, send them this channel, share it with them so that they can also listen and be blessed. Thank you very much.